Mata, just washing my hands. Hi, my name's Amanda Rampulla. I'm a registered nurse, and I'm going to be conducting your physical assessment today. I use the pronouns she and her. Can you introduce yourself with your full name, date of birth, and what pronouns you'd like to use?
Samuel Bloomquist, March 4th, 1994, he, him.
Excellent, sounds good. Today, this is only for education purposes. Please stop me at any time if you feel uncomfortable or if you have any questions, okay?
Mm-hmm.
So just looking at Sam, you could see that the patient is sitting in an upright position. He's relaxed, he's calm, he's answering all of our questions. He is dressed appropriate for the situation. He's well groomed. I don't see any apparent lesions or wounds, and he has appropriate skin coloring for his ethnicity. And we can start our exam. So Sam, can you tell us where we are right now?
Doctor's office.
Good. What's the current date?
July 30th.
Good. What's the current year?
2021.
Why are you here?
Checkup.
Excellent. So first, let's move on to Sam's head. I'm going to see Sam's head. I don't see any lesions, bumps, bugs. I just see some moles. Okay, you can lean back for me. So next, let's just look at Sam's symmetry of his face since he's looking at us. He looks symmetric, but Sam, can you smile for me? Good. Can you frown? Can you puff up your eyebrows? Excellent. So cranial nerve 7 is intact. Next, we're going to just look at Sam's transmandibular joint. Can you clench your teeth? Good. And that tests cranial nerve 5. Next, we're going to look at Sam's eyes. I don't see any ptosis, exothalamus, drainage. His eyelash growth is normal. His eyes are symmetric. I'm going to look at your conjunctiva. I'm going to touch your eyes. Sam, look down for me. Look up for me. Good. Everything looks normal. I don't see any redness or discharge. Next, I'm going to test Sam's visual acuity. We would use the Rosenberg chart. So what we would do is I would hold it 14 inches away from Sam. He would leave his contacts in. Can you cover your right eye? Then I'd have the patient, I'm sorry, you were right. Can you cover your left eye? I'd have the patient read from top to bottom as best he can, and then we would repeat on the opposite. Excellent. Thank you, Sam. Visual acuity is cranial nerve number 2. Next, let's check Sam's peripheral vision. Sam, look straight at my face. How many fingers?
1, 2, 1, 2, 1.
Excellent. So next, let's look at Sam's EOMs, and that's cranial nerves 3, 4, and 6. I'm going to make a pattern, and can you follow my finger with your eyes? Excellent, everything looks normal. So that was 3, 4, and 6 for cranial nerves. Now we're going to look at Sam's pupils. We're looking to make sure Sam's pupils are round, equal, brisk, reactive. We're testing for accommodation. We are also testing for direct and consensual pupillary restriction. Make sure that the room is dim. I'm going to use my light. First, we'll shine a light in either eye bilaterally. And then we're going to go like this. Excellent. Everything looks normal, and that's cranial nerve number 3. And then if we were in the office, we would use a fundoscope. So we would turn the aperture to the white, then we would turn the diopter to 0. We would dim the lights. We would have the patient focus on an object, maybe that vent on the wall. Placing this in my right hand, I would come around to Sam's right eye, stand about 10 to 15 inches laterally away from his eye, brace myself with my opposite arm, and go in 10 to 15 inches laterally, and then go 1 to 3 inches once I see the red light reflex. And then we would go to his opposite left eye. I would hold the device in my left hand, and then we would do the same thing that we did on the right. So moving forward, we did Sam's eyes. Now we're gonna go to Sam's ears. I don't see any drainage or discharge on either side. I'm gonna tug lightly on your earlobes. Any pain?
No.
We're gonna take our otoscope and we're gonna look at Sam's external ear canal, the internal auditory ear canal, Sam's eardrums, and then we're also gonna be looking at the malleus, the cornolite, and the actual eardrum itself. So what we would do is we would pull Sam's ear auricle back up and out. And then I would place the otoscope in, bracing my hand so I don't hurt Sam. And then we would repeat on the opposite side. I just want to test your hearing, okay? So far everything looks normal. Can you just turn this way? And this is cranial nerve number 8. Can you cover your left ear for me? I'm going to whisper something. 99.
99.
Cover your right ear. 99.
99.
Excellent. You can sit back for me. So we did head, ears, eyes, nose. We're not going to test his smell. That's cranial nerve 1. We would have Sam occlude one nostril and then repeat, and I would have him smell something familiar like peanut butter. Now I would just look in Sam's nose, so I'm going to just slightly push back on his nose. Just to look at the turbinates. I don't see any discharge or redness, no swelling, everything looks normal. Next I want to just do Sam's mouth. So I'm looking at his teeth, his gums, his throat, his tonsils. Can I just take a quick look? Can you open for me? Excellent. I don't see anything abnormal. Can you stick out your tongue? Can you move your tongue side to side? Good. And you can put your tongue in your mouth. So Sam moved his tongue appropriately. It was midline symmetric. So that tests cranial nerve 12. And then the rise and fall of his uvula tests cranial nerve 9 and 10. So Sam, I just want to now move down to your neck. Before I forget, I just want to check your thyroid, okay? So for the camera, can you just face this way a little bit towards the window? I'm going to place 2 fingers on your throat. Can you swallow? Can you swallow? Excellent, that looks good. And then, actually you could stay like right there for the camera. Can you look to your left? So Sam doesn't have any JVD, I can't see it. You go to the line of pulsation and his sternal notch. You mark it at a point and then you would measure it, and then his is less than 3 centimeters, so there's no JVD. You could sit back for us. Okay. So we did thyroid, we did JVD. I just want to do the actual range of motion of your neck, okay? So we're going to do flexion, extension, and lateral movement. So we're going to do, follow me. And then ear, and then ear. Excellent. So now let's just check your trapezius muscle. Can you go like this and shrug? Good. And that is testing cranial nerve 11. And then I'm going to put my hand on your face, turn towards my hand. Good. Also perfect. Also testing the same cranial nerve. Everything looks normal so far. Okay. So now we're going to go down to Sam's thorax. He's sitting upright. No retractions, no accessory muscle use. I'm just going to palpate. I'm going to just go to his PMI. Palpate that. I'm going to percuss. I'm going to auscultate. And then Sam, can you turn around and face the window? Palpate. Then I palpate for CVA tenderness. So you want to go to the spine right below the 12th rib. Sam, I'm going to knock on your back. Do you have any pain?
No.
Excellent. We're going to percuss. I'm going to auscultate on the back. Okay, can you just lean back for me? We're going to go to cardiac, okay? So this is Sam's right side, so we're going to go apical, pulmonic, tricuspid, mitral. And then I'm going to listen to the apex of the heart and the lateral part of the heart. Good, I don't hear any murmurs. Can you lean forward for me like a tripod? And then take a deep breath in and out, and I'm going to go right down here. Good, I don't hear any murmurs as well. You can lean back for me. So now we're going to have Sam put his head right here. Perfect. So we want to inspect the stomach first. Do you mind lifting up your shirt? Do you want me to drape something? Are you
No, I'm alright.
Okay. I don't see any lesions. I don't see any scars. I don't see any active peristalsis. No distension. So I'm going to auscultate first. Excellent. I hear bowel sounds in all 4 quadrants. Next, I'm going to switch to my bell. And then we are going to listen to Sam's renal and iliac arteries for any bruits. So next I'm going to percuss. Good, I just heard tympany. You want to hear tympany and no dullness. Dullness could indicate fluid, especially in the lower quadrants of his stomach. So next I'm going to percuss Sam's liver. We're going to go to his right, which is right here. I'm going to expose your nipple, okay? Mm-hmm. So what we're going to do is go by about his fifth intercostal space. Percuss up. Tympany, dullness. Mark the spot. I'm going to use his mole. Start by his nipple. Dullness. And then you measure it and you want it to be between 6 and 12 centimeters. That indicates a normal liver, which Sam's is. And then for the spleen on the left side, I'm going to just percuss and you just want to hear tympany, and we shouldn't hear the dullness of your spleen. Good. So I didn't hear your spleen. That's perfect. So now we're going to do palpation. We'll start with light, which is using one hand. I'm going to palpate your stomach. Tell me if I hurt you at any time. It's also good to just look at the patient's face. Make sure they're not grimacing. Am I hurting you?
Mm-mm.
And now we're going to do deep palpation with 2 hands since we know we didn't hurt him. So now we're going to try to palpate Sam's liver and spleen. You might not be able to, which is good because that means it's not enlarged. So Sam, can you take a deep breath in? Good, I don't palpate it. And then the spleen. One more time. Good. And then we want to check with the fluid. So Sam, can you put your... Perfect. So I'm going to press on Sam's belly. I don't see a fluid shift, so he doesn't have any ascites. Perfect. Thank you. And then can you sit straight up for me? But one thing I forgot to do back in the neck exam, which is fine, we'll just do it really quick. I didn't listen to bruits in Sam's neck. So we want to check his carotid arteries. So before we move on, we'll do that. We'll use our bell. Can you look just a little bit like, yeah. And then hold your breath. Hold your breath. Good, you could breathe normally, thank you. And then also with the cardiac, when you do want to listen to murmurs, just make sure your bell is on because then you have a better chance of hearing the murmur when we were down at like the apex of the heart. Or also like down in the diaphragm area. So now we're going to do the musculoskeletal and the neuro exam together. So just bear with me, okay?
Mm-hmm.
And we are okay on time. So can you actually just put your arms at your side? Good. Do you have any numbness or tingling?
No.
Good. Can you reach up and squeeze my hands? Pull me in. Excellent. Good, good, good. I'm going to feel your pulses. I'm just looking at your joints. Can you lift up your right knee? Good. Lift up your left knee. Looking at your joints here. Looking at your ankles. I don't see any edema throughout. Lift up your foot. Good. Lift up this foot. Good. Okay, I'm going to come back up. So now we're going to just do some special tests, okay?
Mm-hmm.
Just follow what I do, okay?
Okay.
So first we're going to go like this. So this is perfect, the phalanx. Then, do you have any pain?
No.
Hold it for 10 seconds. Good. Put your arms out like this. The tendons. Any pain?
Mm-mm.
Good. Now we're going to scratch our back together. This is 8, please. Good. Let's do the crossover. And then let's bring our arms up. And then all the way down. Good. I just want to assess your joint. So I'm going to actually place my arm right here.
Mm-hmm.
Can you lift your arm up? All the way down. And then all the way across. Good. All the way back. Good. And we tested Sam's joint back when we did his neck. So that looks good as well. So next I want to just check your reflexes. So we are going to also pretend that this is our tool. Can you just try to relax your arm? I see movement. Sorry, can you lift your arm up? Good. See movement. Relax. Good. Other side. I see movement. We would do Sam's knees. Good. Good. Sorry if I'm hurting you.
Mm-hmm.
We'll go to his Achilles tendon. Good. Good. And then we would do the Babinski. We want to just use a sharp object on the bottom of his foot and make sure that it doesn't flare out. Everything looks normal. Good. And then what we will do is I just want to check Sam's knee. Can you lean back for me? I'll lay down actually. Sorry. So we would test this bilaterally. And then for his knee, we're looking at the 3 B's: balloon, ballottement, and bulging. We don't want to find any of them. I'm going to just touch your knee, okay?
Mm-hmm.
They don't look swollen, but we're going to take a bigger look. So we'll do the balloon, the bulge, and the ballottement. And we would do that on either knee. Next, I want to do the AP test. So what we are going to do is we're going to bend up Sam's knee. And it stands for anterior, posterior. We want to make sure that the kneecap isn't moving. Am I hurting you?
Mm-mm.
Okay. And then we're going to do McMurray's test. So we're going to basically rotate his knee internally, externally, and then back. So, like kind of one fluid motion. Good. And then we would repeat it on the opposite knee, the 3 B's, and then do the AP and the McMurray's again. You could stand up for us if you're okay. Are you dizzy?
No.
Good. All right. So close your eyes for me and then stand in one place. Good. Open your eyes. Good. Can you just walk towards the camera, feet to feet? Good. Good. And then rotate towards me and come back. Okay. Perfect. Turn around. And then since I have you standing, let's do this together. We're going to put our foot out, back, side, side. And then we would repeat that on the opposite side. Thank you.